Hi, happy Rakhi everyone. Today's topic is pus formation and swelling in the tooth. So a client came to me, he's my very old client, but because of distance he reached out late, and what happened was a root canal done tooth years ago, probably more than 15-20 years ago, got infected. There was pus formation. He came to me when there was a swelling, noted swelling, which I could see outside the cheek also. He went to another dentist and they said we cannot drain the pus now, and they gave him an appointment. Said the oral surgeon has to come and do it, and he had already started with fever, and that's the dangerous point, because sepsis is the most infectious thing that can happen, because localized infection can spread into the body. That is called sepsis. So the first stage is always fever, and he had already started with fever, though he was on antibiotic as well as Metrogyl. So I immediately drained the pus and he was relieved of the pain, and we could not give him high painkillers because his creatinine was high. So he was relieved of the pain, and after 2 days the tooth was already mobile. So we did the extraction and also curettage, that is cleaning of the inside, the bone, the gums, everything. And I put in some bone graft and gave him the stitches, and still his fever persisted 2 to 3 days after the extraction was done. After that it slowly started reducing, but he was down with weakness. But the most important point I want to concentrate is the sepsis. It's very dangerous. Even a tooth infection can spread into your body through the bloodstream and cause serious effects. If the sepsis sets in and you don't take care of it, it goes into something called as sepsis shock, and it will lead to death. So don't ignore even the smallest of problems. And the thing is, in April, in the x-ray, the tooth had already showed infection and it was ignored. It was not told to the patient. So be careful, choose your dentist also correctly, and never neglect even the smallest of issue. Thank you.